tena, unaendelea kutazama Citizen Town Hall ndani ya Monday Report, na hii leo tunazungumzia masuala ya mitishamba na dawa za kisasa. Ni ipi ambayo inafanya kazi zaidi? Kuna wale wataalamu ambao tuko nao hapa, wengine wanasema kuwa vyote vinafanya kazi, lakini kuna wale ambao wanaamini kuwa dawa za kiasili ni bora zaidi. Sasa nataka kumpatia nafasi Hilda Wanjohi aweze kutueleza tu kidogo kuhusiana na kisa chake cha kutumia dawa za kiasili na pia swali kuhusiana na dawa za kisasa. Hilda.
My name is Hilda Wanjohi, and my history with this mitishambas was really good because I am lactose intolerant and I am also protein allergic, and every time I actually do take a dosage of this mitishambas, I can actually eat meat and drink milk and I wouldn't have any reaction afterwards, but if I don't, I actually have a serious reaction happening. And also my question is that currently we are having like antibiotics that are really resistant. Like you will have a common cold and you're given some amoxicillin or ampicillin, or you're given some cold cap, and they don't work. So what are you guys going to do, like from the research institutes, and what is it that you guys are doing? Because like you'd find that if I have a common cold, I would go for commonly like ginger, turmeric, and since they are really high in antibiotic, and they would actually work compared to me having a dosage of ampicillin or amoxicillin. Yeah, so that's my question.
Kabla hilo swali halijajibiwa, labda tumpatie nafasi sasa Brenda Murugi. Yeye amesema kisa ambacho wanawake wengi watakielewa. Maana kuna mambo mengi tunajaribu kufanya ili kujaribu kupata ile mili ambayo tunaona inastahili. Yeye anadhani sijui kama alipata dawa. Brenda.
Hello, my name is Brenda Murugi. Well, my experience with herbal medicine wasn't so pleasing. My friend told me of a concoction to use to try and slim my belly. Well, I've been taking it for a month now and nothing has worked. And my main issue here is the side effects, because I experienced a series of diarrhea and vomiting and it wasn't pleasing at all.
Haya, labda madaktari hapo watatuambia kama hayo mambo ambayo umekuwa ukiyapata kama ndio tiba ya kufanya tumbo liweze kupunguka kidogo. Karagania naye ana swali kuhusiana na masuala ya elimu pamoja na haya masuala ya mitishamba.
Thank you very much. I suppose it's one question, but I hope for two different answers. Maybe Dr. Waraka Momlole, how much emphasis was actually given to herbal stroke traditional medicine, alternative medicine during your education, your formal education as a doctor? Is it something encouraged? Is it shunned? Is it demonized? And at the same time, perhaps to Dr. Ikamati, or really to anyone, can we create a syllabus, a curriculum, some sort of formalized structure so that we can say, okay, these are the herbs we have researched, this is the information we know, this works, this doesn't work. If you want to become a herbal doctor, traditional doctor, study A, B, C, D, F, G, take this exam. Your thoughts on that?
Hi. Labda tupate kisa kimoja hapo. Yuko nyuma yako Sifuna Kevin aweze kutueleza tu yeye kwa nini anaamini kuwa mitishamba ndio bora zaidi.
Asante sana Mashirima. Mimi naitwa Sifuna Kevin, na the question about herbal medicine, for me, I have this contention that indeed it works, because those men from western part of Kenya, during circumcision time, I believe there's a certain ash when after you have been circumcised, they smash it after cutting. But now it will take only 2 to 3 days. The gentleman will be okay and he will be ready for any service that may be available. So I believe it works. And then I have a comment or a recommendation. Briefly, please. To Madam Jennifer, that you have said that there is some fee that is charged for those people willing to patent their traditional knowledge. Indeed, as by the experience, I say that these people, if the government can waive that fee so that these people can register and be on the role of herbal medicine expert, is it fine for the government to do that.
Okay.
Na asante sana Sifuna. Wahiga, labda haya maswali yajibiwe kisha tuchukue mengine.
Asante sana, wacha tupate majibu kwa sasa, and I think we shall begin with Dr. Waraka. How much emphasis was given on herbal or alternative or traditional medicines when you were studying? And there's a feeling that doctors of your kind shun traditional practitioners.
Yes, that's actually true and correct, Mr. Kuraganya Mamlole. They never gave that emphasis on that. In fact, it's now that in retrospect, I realized that something else should have been done. Because now, when I got the paradigm shift, I started reading a lot and finding out. I got so interested. And I think the problem started with the colonialists. When they came here, they came with a certain mission and purpose to colonize and get resources and transform us to certain thing. We took everything from them and shunned a lot of, because they found people alive here and they found we're not being wiped out, okay, by any disease. And what we're using before that, our herbs and our traditional medicine. So it's actually, when they came, they transferred everything. And you know, I can tell you, I found out that certain plants, like Prunus africana, which has been studied a lot, and he can tell you more about it, works on prostate cancer. And Artemisia, for example, which now, the antimalarial that we're using now, Artemisia, and I think pharmacologists will tell about this, is actually a plant, and herbal plant. So basically, there are certain things which are done. We should not lose our heritage. We should take in, like Professor Orwa said, do studies and see how we can get good. And come to the issue of resistance. And this is one of the main reasons why. Now, there's a lot. It's a whole, that mystery world I was talking about is so huge. It could have answers for when a situation comes that we start getting resistances of antibiotics. As you know, it's a global problem. So let's not destroy our trees. Let's conserve our environment. Let's get them to research centers like what is being done with KEMRI. I like to commend that. That's the move in the right direction in the initial phase, because a lot of discussion will have to go on towards this.
Dr. Waraka, thank you for that, and very interesting perspective on how colonialists shaped how we view herbal medicines in this day and age. Let me bring in Martin into this discussion. Martin, someone is saying we need a curriculum for herbal medicines where each leaf has been analyzed, and even people who are not doctors can go online and find out what this leaf does for them. What are your thoughts on that? Our sister here is also complaining some beautifying product which was meant, she was promised that if you take this one for 2 weeks, you'd get a size, I don't know whether it's size 6, I don't know what size that she was expecting to be, but it has not worked out as well. And those are the things that spoil the name of those in your trade. How would you respond in brief, please?
Okay, kwangu nafikiri kwamba ndiposa dawa ya miti ifanye kazi kwako, kwanza kabisa lazima utumie kile dawa inaitwa detoxifier, of which wakati umetumia hiyo inaenda ku-cleanse, kupave way kwa ile dawa nyingine ipate nafasi yake katika mwili yako. Kwa hivyo kwa dada mwenzangu pale, nafikiri ile dawa alipewa dawa ya kupunguza cholesterol ama nini direct, bila kutoa zile uchafu zilitangulia pale mbele, sababu ndiposa afikie hicho kiwango cha kutaka dawa ya kienyeji kutumia hiyo. Kuna yale madawa pia amewahi kutumia, pengine ni conventional medicine amewahi kutumia kujaribu, lakini ikakataa. Sasa akasema aende dawa ya kienyeji, ameambiwa na mwenzake aende atumie, lakini hakuosha yale kemikali yalikuwa kwa ile dawa. Sasa yakaweka tu ingine juu ingine, ndika react na ile ilikuwa ndani ikakuwa contaminated, kuendesha ikaendelea. Sasa
yeah. Na mwenye Luiza swali ya a curriculum, a syllabus, a standardized one.
Okay.
Oni yako ni ipi?
Okay, a syllabus ni vyema sana.
Ama iko? Maybe iko na hatujui.
Okay, haiwezi kuwa haiko kwa sasa. But tunajaribu juu chini tuiweke, sababu kuna wale nitaita quacks ambao wanajua mitishamba are just leaves and barks. They pick cabbage leaves, wana grind, wanaweka kwa chupa, wanasema hii inafanya hii. So ikiwa naona kama itatusaidia kama herbalist.
Okay.
Yeah.
Hebu jibu swali hawajauliza but mimi nataka kujua.
Yeah.
If I come to you with a cold,
yeah,
how do you know how to treat me? If tomorrow this one comes with a stomach ache, etc. The conventional doctor has a book. They can go to the internet. They can get how will you know what works for what?
Is okay. First of all, I myself am a lab of my own.
You're a lab of your own.
Because I am also a human being. And cold can also attack me. So when it attacks me, I do research with myself. And that is how I know this goes for cold, that this one for headache.
Okay.
Yes.
So in a few words, how many diseases can you treat with your herbs right now, off the top of your head?
Okay, totally what I've done so far as of now, I can cure around 40 diseases, different diseases.
Including, roughly, for our benefit of our viewers?
Okay, roughly like a painful menses. Yes, I can do that.
Colds?
Colds, coughs, those are just minor.
Stomach
ailments has many ailments. For example, the ulcers, stomach disorders, like the belching, those are minor diseases from the stomach up. So to me, I believe that all the diseases that are in the stomach, I know how to deal with them.
Wow.
Of which first I start with my detoxifier.
Okay, okay. Yes. Thank you. That was just to help our viewers understand the scope of herbal healthcare that you provide in your practice. But before I allow Professor Orwa and Dr. Ikamati to also give us their thoughts, we have a couple more questions, many from our audience here. Mashrima?
Naam, waje kidogo umesema Mary paka nikashangaa, labda unaniita mimi tena unaita mtu mwingine. Sasa kabla sija kuelewa, wacha nimpatie Agnes Waiwa nafasi aweze kutuambia tu jinsi yeye alivyofahamu kuhusiana na mitishamba na yale matokeo aliyoona. Agnes.
When I was very young, probably at 10 years, I used to have the ringworms. Many kids, I suppose many kids normally get them, especially if you were brought up in Ushago. And considering the place where I come from, my grandfather and my grandmother would recommend that I go pick the Sodom apples from the forest, then I squeeze the liquid out, then I apply on my head. Together with neem trees, I boil, then I mix both the liquid from the Sodom apple and the neem tree. Now the boiled water of the neem tree. So I applied for around 4 weeks, and the ringworms disappeared. So for me, I would say the herbal medicines work to some extent, but there's still some doubt, because sometimes you don't know what is the cause of the disease, what is the right herbal to use, and considering that there are no scientific equipment that you would use to know the cause and the effects, there are some doubts. So that's my experience with the herbalist.
Na asante sana Agnes, na hilo jambo ambalo umesema huwezi kujua ipi ni ipi, na pia katika tamaduni zingine wengine wakiambiwa ni dawa, wengine utaambiwa ni matunda ya nyoka. Philip, kwa upande wako ulikuwa na swali kuhusiana na bangi ambao kuna watu wamekuwa wakisema kuwa inaweza kuponya baadhi ya magonjwa. Hebu tueleze.
Yeah, so my name is Philip Odingo. I'm also a research scientist in the making. So my question is to Dr. Martin and Prof. One speaker once said that this plant called marijuana can treat 600 known diseases. So I'm currently doing a research, and my question is that as to Dr. Martin, has a patient come to you at one point or another that the medication you prescribed was cannabis sativa? And to Prof, is there any research that's going on concerning weed as popular known in the streets, and if it's going on the medical aspect, can you advise with the young generation or even the older people to use it as first aid before going to the hospital? Thank you.
Philip, umesema unafanya utafiti, ni kuwa uko na huo mmea unafanya utafiti ama unafanya utafiti ule tu wa kusoma soma?
Kwa kuwa sijapata mali naweza ipata na pia naomba serikali siku moja nikipatikana nayo ni kwa matumizi ya masomo, sio matumizi mengine ya masomo peke yake. Asante.
Asante sana Philip. Labda sasa nimpatie nafasi Tole ya Popo aweze kutueleza kidogo kuhusiana na dawa za kiasili ambazo kwa wengi wanapokuwa na mafua huwa wanasema zinawasaidia. Tole.
Okay, thank you very much. My name is Apopo Tola. Okay, I was trying to explain that once I'm caught with a cough or sore throat or cold, I can make some ginger and lemon and maybe honey and warm water, and whenever I take it, the cough or I get cured totally. Then my question is going to the herbalist. Okay, nowadays we have the strange diseases that has come in this modern world, and we had got some diseases past during the golden days. Is herbal applied to the modern diseases? Can they cure them? We have Ebola, we have AIDS, and among others. Are they also applicable to apply the herbs, or we just go by the pharmaceutical medicines?
Naam, asante sana Tole. Na wahiga hili swali lisisahaulike. Tole anasema ametumia huo mchanganyiko wa kitunguu saumu, tangawizi, limau, maji na asali na mafua yanakuisha. Mbona wengine tukitumia haiwezekani? Labda madaktari hapo wanaweza kutueleza kwa nini kwa wengine haifanyi kazi.
Okay, asante sana Mashirima kuuliza hiyo swali. Na pia on Twitter I can see a lot of you are weighing in on this. Remember the hashtag is Monday Report. Kate the actress is saying in Japan doctors give both conventional and traditional medicine prescriptions. Maybe that is why they have a high life expectancy, while at Jakufu says it's colonialization of the mind. The surgeon on the panel has aptly summarized it. It's not too late to start documenting our past medicinal practices. Professor Orwa, let me start with you. The gentleman at the back asked a controversial but possibly important question to some on cannabis sativa and its possible use as a herb. Would you like to delve into that and respond to anything else that you've heard here that you felt you wanted to respond to?
Okay, thank you very much for that question. Cannabis is well researched, and there's a lot of information on the medicinal properties of cannabis. In Kenya, we are trying to legalize it. It's not legal yet. You did ask whether we are already doing research. We cannot do research on a plant which is not legalized, because where are we going to get the source for doing our research? But probably once it is legalized and it can be planted, then we will have a source of plants for carrying out research. But of course, you know, it is also a medicine which most of you young men and women get hooked. So I would not advise you to start using cannabis for prevention, as you suggested, and for trial, because definitely those other side effects of cannabis will not go well with you. So we wait, we carry out the research, we develop standardized medication, and then probably they will have to be used under very strict strict control because of those side effects.
To ensure that they are not abused.
To ensure that they are not abused.
Okay. Dr. Ikamati, you wanted to also come into this discussion. Someone there spoke about resistance of drugs, and they wonder what's the future if the drugs that they know used to work in the past no longer work. Someone else spoke about a drug they thought would change a part of their body, instead side effects, diarrhea, etc. Are these concerns that you as the Pharmacy and Poisons Board have abuse of conventional medicines, and then some turn to herbal hoping that it will do magic for them?
Well, thank you. I think first I'll start with conventional medicines, or any medicine. Any medicine is a double-edged sword. That is what we know. And that's why we control the doses. We know at a particular dose it will be able to treat you, but at a certain threshold, it may be toxic. Some of the medicines can even kill you if you move slightly above. We call them narrow therapeutic index drugs. So with the herbal products, there are also the issue of those side effects. They could be severe. The problem that we have with the herbal medicines in Kenya today is that they are not science-based. We don't know what dose is the herbalist giving. Yeah? They don't know what the side effects are. And that's why with the setting, we need to develop policies, and I'm sure going into the future that we are going to do that. The first thing, starting with the practitioner regulatory authority for the traditional medicine. Moving into, we also want, as Pharmacy and Poisons Board, to encourage the herbalists to take their knowledge to the research centers, such as KEMRI or the other universities. Because once the research centers have done their studies, we use their data now to allow for registration. We also do approve, if they're going to do clinical trials, we do within the Pharmacy and Poisons Board, there's a directorate that is involved with the regulation of clinical trials. So when KEMRI wants to carry out any clinical trial, they have to come to us and we give them the approvals, then we look, our scientists will keep on looking at monitoring on the data that they're generating, and will be able to help in approval of these medicines. In India and China, they've done a lot of extensive research and development on herbal medicines, and that's why in Asia they can be able to use the medicine that can be prescribed, because they know the dose, they know the side effects. They've studied, they've done, as Professor Orwa said, preclinical studies. They start with the preclinical studies. These are studies done within the laboratory. There are things we call the cell lines. You use the chemical and see what are the effects. Then if it is producing good effects, then you move to a higher level whereby you use animals to check on whether it is working. And after that, if it works, that is when medicines are taken up to a higher level to the clinical trial, clinical studies. As Dr. Waraka said about the herbal medicine, yes, herbal medicines work. And as I've said, if they are evidence-based. So we need that person who used, or the traditional herbalists, they need to link up with Professor Orwa and other researchers so that they can be able to tell us exactly when used as a crude drug, or can it be isolated, and then we compare with the clinical trial. You're doing comparative study and you're checking against the gold standard. What is the treatment of choice currently? And when we check, when the researchers check and see both medicines have the same effect, or they prove something we call non-inferiority, then we can say the drug is working. Please note that some of the medicines, some of the conventional medicines have been derived from herbal, from the herbs.
Okay.
Yeah? Look at the Artemisia annua. If you know Artemisia annua, has anyone heard of artemisinin?
One or two are nodding their heads.
Dihydroartemisinin. This was a Chinese herb, and scientists were able to extract that metabolite or that chemical, and were able to process it further and be able to give you the antimalarial that is working wonders today. But as I've said earlier, you've got to have, it has to be evidence-based. It has to be science-backed.
Okay.
And that is what we are lacking in Kenya today. We need to develop frameworks and institutions that can be able to enhance the development of a herbal or traditional medicine to higher levels so that they can be able to be at par with the conventional medicines.
Okay, I think that's a good place to take a break. And someone who has sent in a message here is saying that modern medical doctors are experts in diagnostics, identifying the disease, and pathophysiology. So combining the expertise of modern doctors with herbalists can actually increase success. Even recently, the NIH, I don't know, NIH, that's from which country? National Institute of Health in the US has funded research to evaluate herbal medicine in a scientific way with some promising success. So wish away herbal medicine at your own risk is what some of our viewers are saying today. Others are saying it doesn't work. What are your views? 22422 is the SMS line. Hashtag is Monday Report. More questions and comments from our audience and more feedback from our panel on the other side of this break. We'll be right back.